Hello and welcome to all the students of homeopathy and uh, Dr. Vivek, Dr. Khushbu. Uh, my topic of today's presentation is chronic diseases, new horizons in homeopathy. First, I would like to discuss what is basically chronic diseases and what are the approaches and what are the new developments in homeopathy.
Excuse me, sir.
So, yeah,
Sir, there is a message prompting on your screen. You just please press on
admit.
continue
Okay. Yeah, uh,
in the center of the screen, sir.
just
Just
uh, participants means at the level of just I have one message to admit. I
okay, sir.
admitted.
It's done. It's
It's
done.
okay.
I saw this. Please,
Okay.
you carry it.
Okay. So, friends, uh, first of all, I would like to have a disclaimer that this presentation is only for teaching purposes and it is not for any medical advice or treatment. So, this is simple disclaimer. And I would like to take first blessings from my parents. Uh, and we should always start by taking blessings. And the blessings cannot be started without taking blessings from our master Samuel Hahnemann, who was a German physician who invented a new mode of treatment which we call homeopathy, and he discovered nature's law of cure. He discovered many things, but there are two or three things which are very much important, and one thing is nature's law of cure, homeopathy, and understanding of miasm in treating chronic diseases especially. Now we start. What is disease? First, we try to understand what is disease. So, disease is basically to feel dis-ease. When we not feel well, or when we are aware of some distressing signs and symptoms, uh, then we can say that we are having some disease. Generally, we are not aware of our body or the physiological processes which are going on, like we are breathing, our heart is beating, and many processes we uh, do not notice. So, this is a state of health. But when we start noticing these things in our body, like if we are feeling that we are breathing heavily, or we are having some itching issues, or we are having a peristaltic motion going on in our abdomen, so that means we are not feeling at ease, and this is basically what we can term as disease. Now, the dictionary definition is basically that any harmful deviation from the normal structure or functional state of an organism, generally associated with certain signs and symptoms, and which differ in nature from physical injury. This is basically dictionary definition, which we all can understand. But there are some other understanding of diseases also. Like there is a new approach towards understanding of health and disease. It is basically German new medicine, which was developed by Dr. Reiki Gerdhammer. He perceived diseases in a different perspective, because at this time and in prevailing understanding, diseases are considered as very distressing events. That is okay, but most of the times fear from the diseases, because this can give rise to many troubling symptoms, and sometimes it can lead to death also. So we fear diseases. But Dr. Reiki Geared Hammer, through his uh, uh, yearly continuous efforts, he understood that diseases are a part of significant biological spatial program of nature which is created to assist an organism, and it is humans and animals alike during unexpected distress. That means diseases are not any fearful events. It is specially developed in evolutionary line so that we can become more stronger. When disease ends, uh, we can become more and more stronger for the similar type of problems, uh, if it is being allowed to run its course properly. And he has a beautiful understanding of nature, how nature heals. We have a remarkable healing property in our own body. Just we have to understand it, and we have to understand the processes of nature which is inbuilt in us. So uh, it is very important and understanding, and you can learn it from learninggnm.com website developed by Caroline Marklin from Austria. So because today's my topic is slightly different, so I'm not going in detail, but just I want to give a hint that there is this approach of disease, that it is a significant biological spatial program of nature. Now I would like to tell you the disease approach of predictive homeopathy, which was developed by Dr. Praful Vijakar, and I would like to take his blessings also during my presentation. That diseases are defense mechanism. That means we develop certain sign and symptoms which is developed because we have to constantly face hostile forces in our external and internal environment, and to fight out these hostile forces our body develops a defense, and this is manifested in form of certain signs and symptoms. So this is disease. So definitely then also we should not fear of disease, and we just have to try out to understand the signs and symptoms so that we can understand the process in our body. Then we can understand then when to wait for our body which is healing, which is showing some defensive symptoms. And definitely we have to understand then when we have to intervene with our medicines when body is not capable of healing by itself. So understanding that diseases are defense mechanism uh, is a very important understanding in history of medicine and treatment approaches. Now, we can broadly classify diseases into two categories. One is acute diseases and second is chronic diseases. Now, what are acute diseases? The acute diseases, it is a disease or disorder that lasts for a short time, which comes rapidly, accompanied by distinct symptoms, and is either cured by itself or leads to death. So acute diseases are of very short duration, means a few days to few weeks, and it run its course. There is certain sign and symptoms. It might get cured by itself, or it can lead to death. So we have to intervene if the symptoms are severe and the body is not able to fight out itself. But it is always of a short duration. Now, differentiating it with chronic diseases. Chronic diseases are defined broadly as conditions that last 1 year or more and require ongoing medical attention or limit activities of daily living or both. But this is the definition of National Center for Chronic Diseases in US, how they understand chronic diseases, and it is dictionary definition also, that the duration should be long, and which they say that it is not being, it cannot be cured, it can only be managed, and it limits our activities of daily living. Uh, so this is the prevailing understanding of chronic disease. Now, the very much important thing is ki how can we recognize acute and chronic disease? Friends, there is some more deeper understanding of chronic diseases in homeopathy, which was developed by Dr. Hahnemann. Uh, how to recognize acute and chronic diseases? Uh, this is a slide, but if anyone can talk, I think who can provide some input regarding uh, understanding how can we differentiate acute diseases to chronic diseases. Anyone can unmute and can speak, so we can have an interactive session also. Any student of homeopathy who can discuss that how can we differentiate acute disease to from chronic disease.
Sir,
Anyone?
onset of acute diseases
Okay.
is always sudden,
Okay.
and about the chronic diseases, their onset is most of the time imperceivable.
Okay. Very good. Very good. Anyone
Or
else? Yeah. Anything?
and acute diseases has a very short duration unless or until they are treated with proper medication. They can be fatal. And in case of chronic diseases, they uh, they progress very slowly, very gradually, and after they complete their complete course, it can also be fatal unless or until treated with the correct minimum.
Okay. Very good. Your good name?
So my name is Jhalak.
Okay, Jhalak, very good. You have said very rightly. But one thing I would like to ask from all of you that in a clinic, when you are sitting in your chamber in your clinic and a case comes and he describes some sign and symptoms, you take a case and then how will you decide that this case is acute case or chronic case? Can anyone give input or have an idea? How will you decide that this case is chronic case or this is an acute case?
So with the help of ailment,
Okay. Okay. Means what type of element will you miss? Someone, if someone is coming with, you can say, uh, uh, itching or coryza or pain in joints, then how can you understand that is it a chronic case or it is an acute case?
sir, if there is some sort of accident and then the patient is coming, like the patient has fallen somewhere,
Okay.
there
Okay.
then he is coming in telling, I have pain in this joint, I have fall with this hand extended, so it is an acute condition. And
Okay.
if he is saying that I am sudden and I am having this joint pain for few days, और फिर पता मतलब केस टेकिंग में पता चलता है that he is having the history of arthritis, it would be chronic.
Okay. Yeah, you are very right. What I wanted to hear, the the thing is, Jhalak, you have said very rightly,
So
but I would like,
duration of suffering.
yeah, you are also right, Arpita, you are also right. Duration and the most important thing which we encounter in our clinic or in your clinic, just try to understand ki many times a patient can come with a short duration history that I have this joint pain since 3 days, but it might be a chronic case. How can we recognize this? The thing is, one thing is that if the course is very short, like of a few days or few weeks, then it is very probably that it is an acute case. But the most important thing what I have learned in my clinic, that if we can find some exciting cause in a case and it is of recent duration, then it is most probably an acute case. Okay, that what Jhalak said, that I have got some accident and then I got the pain in my knee. So definitely this is an acute case because it has an exciting cause. or someone has been wet in rain, or has done a lot of work and has got many exertions, and then he got joint pains. These all are acute cases, because it has certain exciting cause and these are of short duration. But if a case is coming to you that patient is saying that I have joint pains or certain pathology which is presented in few days, but I don't know how it appeared. There were no exciting cause, or there are no uh, visible or any टाइप ऑफ थिंग आफ्टर विच इट हैज स्टार्टेड, ये खुद से हो गया, ये अपने आप हो गया, हमें भी नहीं मालूम है. लाइक पेशेंट सेज लाइक दिस कि क्यों ये पैदा हो गया हमें नहीं मालूम. बस आई हैव गॉट सम aching pain, it started at evening and it is growing worse and worse. So this case is basically when you do not get exciting cause easily, uh, most probably it is an chronic case, because it is developed due to some our due to
So due
underlying
to
miasm.
absence of prodromal stage.
Yeah, it might be that we have that predisposition in our body, and at a certain time, at a certain period, it has got started. So this case is a chronic case from the beginning. So you have not to take it as an acute case, because if you are taking it an acute case, then the approach will be different for treatment, and if you are taking a case as a chronic case, then the approach will be different. So it is very important. So my next slide is basically uh, that what how to recognize acute and chronic diseases. So acute diseases are of short duration, days to few weeks. Chronic diseases are longer duration, months to years. And acute diseases have definite exciting cause, and this exciting cause is the first symptom to take during treatment of acute diseases. This is very important. And chronic diseases, it might come with or without exciting cause. So if it is coming with exciting cause, then also it might be chronic disease. Then you have to understand to take the case more, or first you can treat it as an acute case, and if it is not responding, then you can go for a chronic case. Acute diseases are always physiological, that there is no structural changes involved mostly. So physiological means the changes at the level of function, it is not permanent structural changes. But chronic diseases, it might be physiological and structural. And if a disease is structural, then it is always a chronic disease. Means there is structural changes, means you have bending of joints, or you have uh, certain eruptions for a long time, or any structural change in the pathology, then it is always a chronic disease. Acute diseases have no recurrences. If a disease is coming again and again, then we have not to treat as an acute disease again and again. One time, first time you can take it an acute disease, but if it is recurring again, that means if you are having a coryza again and again in rainy season, then this disease is a chronic disease. So recurrency is also a parameter through which we can understand a disease is chronic or acute. So acute diseases are like acute rhinitis, acute pharyngitis, acute gastroenteritis, acute urethritis. Any inflammation which is you can get comes under acute states. Chronic diseases, as you know, that migraines, COPD, asthma, hypothyroidism, diabetes mellitus, psoriasis, warts, autism, and like this. Now, what we get the definition of chronic diseases, yeah, understanding of chronic diseases. Actually, prevailing system understands chronic diseases regarding with duration and its longevity, and it cannot be cured in a way. But how Hahnemann understood chronic diseases, because Hahnemann treated diseases in an acute way, and the diseases came and again, and Dr. Hahnemann researched a lot, years and years, and then he understood the nature of chronic diseases and how to treat these chronic diseases, and then he wrote chronic diseases book, in which he wrote that their beginning was promising, the continuation less favorable, the outcome hopeless. That means the chronic diseases, it looks like that they have simple things, simple symptoms and simple signs, but they continue to grow, and ends in not in good condition, and it can lead to very miserable condition for a patient, and it can never be removed by strength of any robust constitution. It can never be overcome by the most wholesome diet and order of life, nor will it die out of itself. But it is even more aggravated from year to year through a transition into other and more serious symptoms. So this understanding, it was the observation of Dr. Hahnemann in his clinic, in his surrounding, and the literature through which he has gone. He translated many books of his time and of before his time, and he understood that the nature of chronic disease is as such that it is not, it cannot be cured by itself. That means you just leave the patient for a good diet and good rest and all those things, and it will be cured. No, he said that the chronic diseases grow and grow with the time. It become more and more complicated. Definitely its process can be, it can be lessened by good environment, good diet and good order of life, but it is not being cured by itself. So chronic diseases are the uh, most powerful things which has been imparted in our health, which cannot be removed by itself. So it how to improve it, how to remove it, it was the work of Dr. Hahnemann many years. Now Dr. Hahnemann, when he understood the nature of chronic diseases, he understood the nature of acute diseases, then he planned for the treatment of chronic diseases. I am not going in much detail, but the basic things through which what he advised, how we can approach. So this is aphorism 5. You all have read and have gone many a times, that useful to the physician in assisting him to cure are the particulars of the most probable exciting cause of the acute disease. Here we are concerned with chronic disease as also the most significant points in the whole history of the chronic disease, to enable him to discover its fundamental cause, which is generally due to a chronic miasm. In these investigations, the ascertainable physical constitution of the patient, especially when the disease is chronic, his moral and intellectual character, his occupation, mode of living and habits, his social and domestic relations, his age, sexual function, etc., are to be taken into consideration. So the important thing is, uh, what was the understanding of Dr. Hahnemann, that we are not just have to focus on the one aspect of the disease, which is which the patient presenting. For an acute disease, you have to search for exciting cause, but for the chronic disease, it is prevailing in the whole organism. A patient might come with a symptom which is present since a long time, like a patient is coming to you for a problem of lipoma, okay, uh, but you have not to focus only on lipoma or some growth under skin, uh, but you have to understand patient as a whole. You just have to try to find out the uh, other sign and symptoms in the patient present, with which he is presenting, and the sign and symptoms which through which he has gone in past. So this and the patient's constitution, that means his disposition, his moral and intellectual character, his physical disposition, and along with this also you have to understand his occupation, what he does. Can this occupation is giving him the symptoms of disease? Like if someone is working in a glass factory, he is continuing inhaling that fumes, then he might develop some chronic disease. So this is very much this is to be understand that understanding occupation, what is your mode of living and habits, we can remove the obstacles which comes in the way of treatment of chronic diseases. So uh, many things are important during treatment of chronic disease. So Dr. Hahnemann has understood that we have to focus patient as a whole, and we have to plan out, we have to search a portrait which can constitute a patient's totality. That by that way you can understand a chronic disease, because chronic disease is not single folded, it is many folded, and you have to understand all the folds and all the layers and all the symptoms, and then you can search out a suitable homeopathic remedy that will start improving our will be able to help to cure chronic disease. Now in aphorism 153, now the thing is ki what Hahnemann has seen that when we take a lot of history, present and past, so you have lot of symptoms. Then how to proceed? In the lot of symptoms, uh, what to take to start or to practically how to understand that which symptom is more important, which symptom is less important, because you cannot work out all the symptoms in every case to search out the remedy. So what symptoms are more important, what symptoms are less important? So in aphorism 153 he said, the more striking, singular, uncommon and peculiar, that is characteristic sign and symptoms of the case of the disease, are chiefly and most solely to be kept in view. For it is more particularly these that very similar ones in the list of symptoms of the selected medicine must correspond to. That means uh, from the list of symptoms, you have to first try to understand what symptoms are common, what are uncommon, what are peculiar, rare, more striking, singular, or in a way we can say characteristic sign and symptoms. And uh, this you have to match with the PQRS are striking common symptoms of the medicine which has been written in Materia Medica. So this is the way uh, to reach to a simillimum in a chronic case. So this important this is important aphorism with to start the treatment in a chronic disease. Any problem at this level? If you want to anyone want to ask any question or anything like, are you getting me? Things are clear?
In case of any query, please ask your questions. You may
If
also
you're
type in chat box. We will read it out. If there is no any question,
okay, then we can proceed. Now the thing is that how to treat chronic diseases. There is important aphorism 211. What symptoms to consider and first, and we have to take all the symptoms, but what to give importance in a chronic disease in your clinic, especially when you work in your clinic. And Hahnemann, Dr. Hahnemann worked. So we take a deep case because chronic cases are that they display many signs and symptoms. Uh, what to look for. So what he said that this holds good to such an extent that the state of the disposition of the patient often chiefly determines the selection of the homeopathic remedy as being a decidedly characteristic symptom which can least of all remain concealed from the accurately observing physician. So Dr. Henman first talked of PQRS symptom or characteristic symptom. Now he is saying that in a chronic disease and in acute disease also, the disposition of the patient. What is the disposition? Disposition is the particular trait or symptom which the patient is showing again and again. Okay, so in a chronic disease we are not taking only acute totality, we are taking chronic totality. So we are just going into the past history also, that a patient has come with a problem of arthritis and is showing is very angry, is very rude. So when we try to find out in the whole history that are you angry at other incidences also, and patient said yes, I am an angry person since my childhood. So this is the angry disposition of the patient. So in a chronic disease, we have to uh, take this disposition of anger. But if a patient is saying that no, I was a mild and very gentle person, and since arthritis I have become very angry, so this is an acute disposition. That means the it is not a chronic disposition, it is an acute changeable disposition. So when we give a chronic remedy, we have to consider that disposition which is chronic. Okay, so it might be that we can treat it first as an acute state, and then we can give a chronic remedy also. But if his state did not change, he is still angry and is an angry disposition, we can take it as a chronic case, uh, and we can treat it by taking disposition anger. Uh, Now, what Hahnemann has said that we have to consider PQRS. So anger is a common manifestation in many diseases. We have to go to repertory and we have to find out the differentiating sub rubrics of anger. We have to probe more and more to find out when he is angry. That will give his sensitivity. When he is angry, which means anger when there is injustice. So if patient displays this, so this is uncommon. This is not much common, that everyone is not angry at injustice. Few people are sensitive enough to have anger on injustice, or anger at the time of bed, going to bed, or anger after eating, or anything peculiar when you got. And this, if it is displayed again and again, so it is chronic PQRS disposition. What I understood in my clinic and how I work, I just try to find out the chronic characteristic disposition of a patient in a chronic disease. So if you find this thing, then that will be your entry point. Are those symptoms will be your the core symptoms to prescribe for a patient. So this is very important, that the state of disposition of the patient often chiefly determines the selection of the homeopathic remedy. And if you find one, two, or three such type of disposition, and especially at the level of body, physical, at the level of mind, then you can make a true picture of chronic disease, and which will be very reliable for prescribing. So just remember it in your mind, and I will discuss a case and I will make it more clear. Now the thing was that what is the etiology of chronic diseases? So Dr. Hahnemann said that the etiology of chronic diseases is miasm. Miasm is basically miasma. At the just try to understand that at the time of Dr. Hahnemann, when the pathology was not that advanced, the 250 years back, the concept of bacteria, viruses, and fungi, and what causes diseases was not clear. I think bacteria and viruses were not seen also, and there were prevailing many type of theories. So what Dr. Hahnemann tried to understand that it is the cause of chronic disease is something more deeper and more broader. So he tried to differentiate it from acute disease. He gave a theory of miasm, and which was very crucial in the treatment and understanding of chronic disease. So he divided all the diseases into two broader categories, or into two broader miasms. One venereal, and second non-venereal. Venereal means related to sexual disease relating with genitals, sexual disease especially, and especially diseases prevailing at his time was very important: syphilis. And second was psychosis. Psychosis was fig warts on, especially on genitals. So the venereal diseases and non, so he classified diseases, all the diseases in venereal and non-venereal. Venereal and venereal diseases he classified as syphilis and psychosis, and all the other diseases into sora. So this was a very simple understanding and plan, which looks at this time very simple, but this was very much important at the time of Dr. Hahnemann, how we approach a case. Like for syphilis, he advised treatment with mercury, and for psychotic warts or psychotic growths at genitals, thusa and nitric acid, thusa alternating with nitric acid. And all other diseases he categorized under sora, and he advised to give antisoric medicines like sulfur, lycopodium, calcarea, graphitis, causticum, all those polycrest remedies, except mercury, thusa and nitric acid, he uh, advised to give to the patient by taking a thorough case. And in cases of syphilis also, he advised that first you give mercury and then you give antisoric medicines like sulfur, lyco or calcarea, according to the picture totality. So this was the basic plan of Dr. Hahnemann to treat in chronic disease. And during treatment of antisoric treatment, he advised all the things to take: disposition, PQRS symptoms, on all this. And if you need, then you can give alternately antisyphilitic medicine, that is mercury, along with antisoric. Or in a cases which involve all three miasm, means patient has syphilis also and has psychotic warts also and many other symptoms also, he just advised to give antisoric remedy, then anti-syphilitic remedy, antipsychotic remedy, and to go on cycle, in a cycle again and again, so that the whole miasm get cleared. So this was basic understanding for the treatment of chronic diseases, which was developed by Dr. Hahnemann, and he was very much successful in understanding and treating chronic diseases of his time. So if you want to ask anything regarding at this stage, I am ready to give answer. If you can write in chat box also, or you can unmute and ask also. If you have anything to understand regarding miasm also. I think it is clear because you all have read and understood in your classes also. So now just I try to give you a case. That is one chronic case of obstinate constipation. Okay. The name is Baby X. Age is 2.5 years, a female, and her chief complaints was that very hard stools, very painful during passing of stool. Mother has to remove it from fingers since birth. Means it was very troublesome for the mother. First, mother came for her treatment, and then he discussed this case with me. So the child become very in a very distressed condition during passing stool, and she avoids passing stool until it is not much needed or pressured by the mother, and then she screams and mother removes it from fingers, and it is going on since birth, means since 2.5 years, and she tried many laxatives and many things, and things did not improve, and she had recurrent coryza since 1 year. Now, birth history was that she was being delivered by cesarean section at 9 months 7 days. That means slightly delayed delivery. Means when she was there was not much pain after 9 months 5 6 days. Then the doctor decided to make a seizure. Mother's history during pregnancy was that many anxiety. She was very anxious related family affairs. Uh, in day-to-day life, she has got many family conflicts which she was difficult to digest at the level of mind, and it was going on throughout pregnancy. The childbirth was 4 kg. Normal birth weight is 2.5 to 3.5 kg, but she was slightly overweight, and his developmental history was almost normal. I took a full case, but I am just presenting the points or important points for the case. That physical generals, the thermals were hot, she was thirsty, she craved, she licked iron. मतलब उसकी मदर ने बताया कि वो लोहा चाटती है. So she has a craving for some abnormal things. Her urine was normal, perspiration profuse, sleep position. She has having a peculiar knee chest position. She sleeps on knee and chest, uh, and become comfortable. And she was very restless and active during night. Her mental generals was that child was hyperactive. Means, she has shared a video with me. I was not able to brought it back, but the child was jumping from bed to ground, and just very hyperactive. She did not listen or have attention to mother, and she has a habit of breaking her toys. She was very playful. She was very restless, and it was very difficult for her mother to manage. This is the child. You can see the knee chest position she is comfortable with. So this is the position few children sleep like this. Okay. Now we have to analyze this thing, that what is the chronic disposition. In this case we can find out. There are when the patient comes with chronic diseases, there are some uh, there are a lot of symptoms many times, and there are many times they give very short history, few symptoms. So these are the things that we have to try to find out more and more and more symptoms. If we can find out more and more symptoms, then we can work out with what is common and what is uncommon, and uh, what we have to take, what we have not to take. So in this case, what I found that the chronic disposition was, first thing was the pathology, that was constipation, which was obstinate, which was presenting through and through and through since her birth. And second thing was the hyperactivity in children. uh, Hyperactivity in children is many times a common disposition, but in her case it was a very peculiar thing. So a common symptom will become peculiar if it is exaggerated. Means uh, if any pain can give you a peculiar sensation, that means stitching pain, burning pain, it becomes peculiar. If it is dull aching pain, that is common pain. So hyperactivity, if it becomes very very high, that it becomes peculiar or characteristic for a case. Now, the very peculiar sleep position that uh, she was comfortable in knee chest position. So it is also not common. It is also a peculiar chronic disposition for that child. So I repertorized the case and I took the rubrics that restlessness, nervousness in children, hyperactivity also, and sleep position, knees on, elbows, uh, and constipation, obstinate. And after repertorization, I got the remedies, and Medorinum, Lycopodium, Umbra grigia, Bryannia, Pulsatilla. These were the hot remedies. Patient's disposition was hot. She did not felt comfort in uh, in warm situation. She did not like to wear blankets. She liked to uh, bath with cold water. Almost did not like to wear much clothes in winters. So the child was hot. So these remedies and were came in repertorization. So then I differentiated the patient on the basis of his other symptoms and other dispositions, because it was a long case. Uh, the child was not like lycopodium, because when we repertorize a case and we get we come to few remedies, and then our job is to go to Metra Medica. We try to understand the case and we try to match the essence of the remedy with the essence of the person's case, chronic case. So uh, after analyzing the whole case, I gave the patient remedy Medorinum 200, one dose, and uh, along with placebo, and we plan to follow up it after 1 month. Now, after 1 month, what happened? There was a very good improvement. That patient was very much better in constipation, and she passes stool every day without any pain. Coryza aggravated after few days of medicine, remained for 1 week. Now it is also better. Sleep is better. Appetite, thirst is normal, and she is more obedient. What happened that she became more obedient and less hyperactive. Means the mother was now able to control. So the remedy was very correct and uh, very matched with the disposition of the child. So I again prescribed placebo as Dr. Haniman has advised. And now I would like to give you the follow-up video. Uh,
एक महीने पहले कैसा था और अभी कैसा है?
एक महीने
कॉन्स्टिपेशन
पहले इसको बहुत प्रॉब्लम थी और इसको लैट्रिन बहुत कड़ा, कभी कभी ब्लड भी आ जाता था और हमको उसको जबरदस्ती करवाना पड़ता था लैट्रिन,
निकालना भी
उंगली
पड़ता
से दबा के। और अब जब से दवा की है तब से कभी हमको उंगली से दबा के निकालना नहीं पड़ा और ब्लड नहीं आया और रोज लैट्रिन भी कर रही है ये।
एक महीने पहले ऐसा होता था?
हाँ, एक महीने पहले ऐसा होता था। जब से दवा की इसको बहुत रिलीफ है।
और ये कब से था प्रॉब्लम इसको?
ये जब पैदा हुई थी तो ये कभी लैट्रिन करी ही नहीं पतला।
अच्छा।
ये जब लोग बच्चे पैदा होते हैं तो 16 महीने तक लैट्रिन करते हैं ना, ये पैदा हुई थी तब से ही ये बड़ा लैट्रिन कर रही थी।
अच्छा।
और हम लोग सोचे सही हो जाएगा, थोड़ी बड़ी होगी सही हो जाएगा, तो फिर हमको समझ आया कि इसका इलाज हमको करना पड़ेगा। जब इसको ब्लड दिखने लगा, ब्लड
कितने साल की है अभी?
2.5 साल की है ये। ब्लड से फिर पाइल्स वाइल्स भी हो जाएगा इसको। जब से ये दवा लिए हम इसको 1 महीने में अपने आप लैट्रिन इसको हो रहा है।
रोज हो रही है?
रोज कर रही है।
खुद से बताती?
हाँ, बताती है कि मम्मी लैट्रिन लगाए हमको।
अच्छा।
I think everyone understood this. So this was simple case, because I got the disposition very clearly, and the response was so interesting. You can understand that in 1 month, the long-standing 2.5 year problem get very much resolved in 1 month. So you can understand how homeopathy is helpful for chronic diseases. And this case came in January 21, and her mother came 2 or 3 weeks before also, and how I asked her, and she said that her daughter is very fine, and she is passing stool every day, and she is very comfortable in every way, and she is less hyperactive too. She is very active still, but that is easy to handle. So now, with this case, I would like to give some essence of medorinum. What medorinum basically is, and when you approach a case and you have to give medorinum, this essence has to be matched. So these are practical points, that medorinum is a remedy that goes to extremes in its pathology on all levels. It seems incapable of maintaining a neutral, stable state. And this has been taken from Essence of Materia Medica by Dr. George Vidulkas. So the thing is that just you try to understand that patient is hyperactive physically, and you can say mentally also, mentally, physically, both. There is hyperactivity, but there is total inactivity of rectum. Patient's mother has to remove stool by her finger. So can you understand the pathology in a person at two extreme levels? There is hyperactivity at the level of mind, and there is total inactivity at certain physical level, at the level of intestine. So this is extremes of pathology. If you can find a patient showing extremes of pathology in the same patients at the same time, especially, then you might think of medorinum. Or if you are prescribing medorinum to a patient, just try to find out that in his or her whole life, uh, is he displaying extremes of pathology. That means a patient becomes hyperactive sometimes and becomes very dull and very calm certain time, very slow certain times. So certain hyperactivity at organ level at some time, and certain hypoactivity at certain line. The patient modulates between this polarity. So this is the essence of medorinum, because medorinum is a no-so drug. So I'm not going into deep full understanding of medorinum. Medorinum patients sleep on abdomen or knee chest, especially children. Children sleep on knee chest. There are other remedies also which sleep on knee chest, like lycopodium, as you have said in repetition, umbra, pulsatilla can also have. But how I choose medorinum was the basic disposition and understanding of medorinum, that it is having extreme of pathology in the patient, in the child, which other remedies did not display. So I think it will be clear why I give medorinum to this case. So anything to ask by participants? Things are clear? Just you can unmute and say that things are clear at this stage.
Yes, sir, we are getting you.
Okay. Let's move. Now the thing is ki, this was the basic understanding of homeopathy, but it looks the case is very important, and it got solved very easy. But there are many cases which are not that easy to handle, and since there are new advancements of anatomy, physiology, pathology, embryology, genetics, and other life sciences in last 2 centuries, since Dr. Hahnemann discovered homeopathy. So homeopathy has to grow and to find more and more solutions for suffering humanity. So there are new approaches evolved in homeopathy in order to make it quick and right therapy, and to stand and grow with modern scientific world. So the very important thing is that we, as a homeopath, and homeopathy has also to match with the developing sciences. So we cannot make understand modern scientific people what is miasm. And if you say that you give antisoric treatment and antisyphilitic and antipsychotic in the way, and also for treating diseases which are getting more and more complex, and newer diseases are coming. So by in the scenario of advancing pathology, homeopathy has also to grow. So there are new approaches and new things is being incorporated in understanding of homeopathy, which make it more better science and more easy to handle cases. So one approach I am today in New Horizon, I would like to discuss only one approach, and there are many approaches. The approach by Dr. Praful Vijayakar's predictive homeopathy, which usually I follow in my clinic, and there are other approaches also like Dr. Rajan Shankaran's sensation method homeopathy, Dr. George Vidulka's theory of layers in treating chronic diseases, and Dr. S.K. Banerjee's unique approach, Dr. Sahgal's mind approach, and there are other also at this present time which is evolving, and you should learn and try to read all those things in order to become a better and good homeopath. But what in my clinic, what I was fascinated and was attracted towards predictive homeopathy of Dr. Praful Vijayakar, because it gave me many scientific understanding and many scientific solutions which I did not find in classical homeopathy, uh, which satisfied my mind. So Dr. Praful Vijakar sir researched and worked and understood modern pathology and modern genetics, modern embryology, and he came to a conclusion that etiology of diseases were definitely miasm, and miasms are defense mechanisms at genetic level. Okay, so a cell has only 3 defensive responses, and there can be only 3 miasms. And there are 3 major pathologies. When you study Robin's pathology, you can understand that there are 3 major pathologies possible. One is inflammatory pathology. Second is proliferative pathology, in which there is growth, tumors. And third is destructive pathology, in which there is destruction of tissues. So broadly speaking, there are 3 main pathologies possible: inflammatory, proliferative, and destructive pathologies. So miasms, he differentiated miasms into 3 basic category. First was the inflammatory or irritative pathology, that is soric miasm or soric pathology. The accumulative or proliferative or psychotic pathology, and third was the degenerative destructive pathology, that is syphilitic pathology. So these are 3 basic miasms, and uh, there are uh, cases in which 1 or 2 miasms uh, be together, like soric and psychotic pathologies, sauropsychotic pathology, psychosyphilitic pathology, saurosyphilitic pathology. So according to the pathology or the case, uh, there may be intermediary things also, but the broadly speaking, the miasms are, he classified it in 3: inflammatory, accumulative, and degenerative. Now, I am not going to much detail also of the miasm, but this was the basic approach. This is important because Dr. Hahnemann classified diseases into syphilitic, psychotic, and soric diseases. But his understanding was the understanding at the time of Dr. Hahnemann, that was 250 years back. But now we understand pathology in a more better, more understandable and scientific way, and we have to plan our treatment and plan our understanding in the modern way. So we put all destructive diseases in syphilitic diseases, all proliferative or tumor or growth type of diseases into psychotic diseases, and all inflammatory diseases in irritative inflammatory pathology, that is in soric disease. So this helps in approaching a case and approaching our symptoms and our repertoire also. So the treatment approach of predictive homeopathy is basically to take a full case as Dr. Hahnemann advised, presenting past and all the things associated with a patient in a chronic case. Especially we are talking a treatment approach in a chronic case, and you first have to understand what is to be cured in disease. Like if a patient is coming to you for a treatment of simple lipoma, or for a simple rash in his body, then you have to, when you take your full case, you just understand, try to understand why has a patient come to you, is why like single lipoma is very troubling, or why single lipoma is very much problematic in him. And upon inquiry you find that it is the anxiety health, it is fear disease which is to be cured in this disease, rather than to focus on lipoma. So now you have to understand and identify the miasm, that is fear disease, it is the psychosis. So you have to cure his fear of disease. That means you have to cure his psychosis, which is fear. It is not the lipoma you have to focus. So then you have to try to find out what are other fears. Is there any panicky situation also, which is considered under syphilitic miasm? So if you can find any syphilitic disposition in a patient, you have to take that as an entry point. So the thing is that by understanding what is to be cured in the disease, you have to identify the miasm, and then you have to search for the PQRS or characteristic of that dominant miasm. Like if the miasm is psychotic, then you have to find out the PQRS of that psychotic pathology. Many times it is very difficult to find out PQRS symptom in a psychotic disease. So if you do not find that, then try to find out the PQRS of soric manifestation or soric disposition of that patient. That is basic, many times the sensitivity of the patient. And just try to find out, is there any syphilitic disposition in that patient throughout his whole life. And if you find that, that will give you the whole right picture of that patient. So you have to focus on the disposition, and it is better if you find the higher miasm like syphilitic PQRS disposition in a patient, and his syphilitic after syphilitic soric disposition, PQRS of soric disposition, that is his peculiar sensitivity, soric sensitivity. If you get these two things, then try to find out psychotic disposition if you get any PQRS symptom, but not common symptoms of psychosis you have to take. So this will give the more clear and more accurate picture of that patient, and then that will be the right simillimum. Actually, if miasm is not being covered in the right way, means in right hierarchy, what you have to take first and what you have to take second, then you will miss the rubric, you will miss the case. And because many remedies will be similar to a particular case, which remedy is simillimum, it is very important when you just try to find out in this way. And Dr. Praful Vijayakar has given innumerable difficult cures in his practice with this approach. So enter the case through PQRS of miasm at the level of physical and mental. Like if you get a physical pathology, like if you get a patient of a tumor, then you just try to find out the psychosis at the level of mind, and is there any syphilitic trait or syphilitic symptomatology, that is any destructive symptomatology at the level of mind also. And that then after this differentiate medicine according to their chronic disposition. And then after giving after remedy, you have to follow up according to Herring's law of cure, which Dr. Praful Vijayakar evolved through many layers in the body. You can read it in predictive homeopathy, because I have not that time to discuss whole, but just I am giving you the input of approach. It is better to discuss with a short chronic case, which I recently treated, and the name of the patient is Mr. Y, and he was 29 years old, and his chief complaints was he has recurrent coryza with frequent nose obstruction, especially from left side, since 4 months. And his nose was very much obstructed again and again, and he got discomfort in working. He has a small business a shop, and it was making very difficult, and he took many treatment and did not got better. So he consulted me. And second symptom after inquiry, he said that he has numbness in his right little finger and median dorsal portion of hand since 1 month, and he has recurrent flatulence with frequent stools with incomplete evacuation since many months, and this was since a long time he was suffering. Now, physical generals was that he was chilly, thirstless, his perspiration was offensive, sleep was normal, urine was normal, and not much peculiar was found in his history. Mental generals, which I took, that he was very anxious about his health and very cautious regarding his health work. Means he has got many investigations, and he consulted many doctors again and again, and he was very cautious that he's having obstruction, he might got polyp or anything which will worsen his problem. And he was very impatient also. Means he told in his history that his disposition was impatience. He is not satisfied with easy. Means he cannot wait someone for a long, and he did things hurriedly. Means he cannot wait. He do things fast. He has a hurry tendency. So I analyzed is that what was the syphilitic in his case, and the first thing is one was the impatience at the level of mind, but the physical complaint which is presented was the mostly numbness in finger. In his right little finger there was a numbness, and in his dorsal hand also there was numbness. Second was the psychotic pathology or psychotic miasm was the cautiousness. Cautiousness is a psychotic rubric. When we become cautious for the things, and this cautiousness comes out of fear of being diseased or any type of thing. The patient was cautious. And second was hurry. This is also an exaggeration. This is also an proliferation at the level of mind. That hurry, you just do things fast. So this was the psychosis. And the soric part was that he has got anxiety health, concerned since long time, that if anything happens to him at the level of health, he becomes very anxious. So I repertorized the case with that numbness, insensibility, fingers. The rubric is extremities, impatience, hurry, haste, cautious, and he has got anxiety health about. So the remedies which came was lycopodium, natrum mure, sulfur, thuza, and natrum tar. Considering his disposition and some other symptoms, what I gave to the patient, I gave him Thuza occidentalis 201 dose, followed by SL for 10 days, and I took follow-up after 10 days. What happened that after 10 days, his finger numbness got 60% better, and his nose obstruction was 80% better. His GIT was better. His general energy was better. So that's showing if syphilitic symptom is better, then we can be very sure that remedy is right. If the patient has come to you and said that his numbness has increased and his coryza is better, this is wrong follow-up. The right follow-up will be when the higher destructive miasm comes down, and if other symptoms are psychotic miasm or symptoms of pathology is slightly aggravated, that is no issue. In this case, it was, I think, perfectly simillimum. So his nose obstruction was got also 80% better, his GIT was better, and his general energy was better. So this was the case, and I have a follow-up video. You can hear.
प्रॉब्लम क्या क्या थी थोड़ा बताइए
सर। प्रॉब्लम सर मेरा हाथ में सुनपन था सर। बाकी सर हमें सर थोड़ा एलर्जी का सर प्रॉब्लम था। और सर पूरे तरीके से पेट कहीं साफ हो रहे थे, और बार बार सर छींके आना, जुकाम बन जाना टाइम पे।
अच्छा
सर काफ़ी रिलीफ हुआ हमें। सर 10 दिन से दवा खा रहा हूँ।
अच्छा 10 दिन पहले आप आए थे 10 दिन
जी सर।
हाथ में सुन्नपन कब से था, कहाँ पे था बताइए?
ये सर यहाँ पे था।
हाँ
और इसकी वजह से ये पूरा था पोर्शन, ये पोर्शन था। और जब सर मैं दवा खा रहा हूँ लगभग सर बहुत रिलीफ है सर।
अच्छा कितने परसेंट आराम हुआ वो 10 दिन में लगभग?
सर लगभग 60% से 50% सर लगभग लग रहा है रिलीफ।
अच्छा और नाक में?
नाक का सर ये सब पूरा मेरा लगभग हमेशा बंद रहता था।
हाँ
जब सर मैं दवा खा रहा हूँ तब सर बहुत रिलीफ है, बहुत मतलब पूरा सर फ्री हो गया है।
अच्छा पेट में क्या आराम है?
पेट में सर खाना खाने के बाद मुझे सर हमेशा फ्रेश हो जाना होता था।
अच्छा।
वो सर अब प्रॉब्लम खत्म हो गई है।
आराम नींद वगैरह?
नींद वगैरह सब पूरा अच्छे से आता है।
So, I think the case was clear to all of you.
Yes, sir.
Okay, you
Yes, sir.
understood it. Okay, now now this from this case we can understand the thuja. The basic understanding of thuja is that thuja is a very delicate and fragile patient. Means this is at the genetic level, he is delicate and fragile. So if a person is who is delicate and fragile at the level of body and mind especially, then definitely he has to be cautious. So the cautiousness of Thuza is due because he is delicate and fragile at the level of genetics. And other some symptoms are, so this is the crux of Thuza, that if you feel a patient is very cautious and because he feels very vulnerable from inside, just as he will be very diseased easily, uh, he will be having a lot of problems in future regarding his health, his finances, his social life, all these, and he works very cautiously in all his aspects of life, social, his in family life, his financial, his work. So this is the crux, or this is the essence of Thuza personality. So I gave Thuza after understanding this disposition, that he was very delicate, fragile, and he became very cautious since childhood. So it was a deep remedy for deep and simillimum for him, which gave a very good result. And I think it was a recent case, and the patient came again after 1 month, and he is very much better. And he is going on placebo with single dose of Thuza 200. He has got, yeah, patient of Thuza has got many fixed ideas. Uh, they there is aggravation from 4 a.m. to 6 a.m. in morning, especially in cases of children. The children wake up at 4 a.m. and they keep on crying up to 6 7 a.m. and then they get again to the bed and sleep. So this is a peculiar Thuza child. Are a person's pathology is aggravated 4 a.m. to 6 a.m. and there are mostly left-sided complaints. Warts are very peculiar to Thuza, and vaccination aggravates. After vaccination, their complaints, their problems which has been hidden come to surface. So in this corona period also, you might get many Thuzo constitutions coming to your clinic because they take vaccination and their problem which has been under cover is coming and opening with symptoms and signs. So just then try to understand, is it a Thuza patient or not. So if after vaccination the complaints you can get in a patient, just try to find out Thuza also. There are other remedies which has vaccination aggravation like silicea, sulfur, but Thuza is a prominent remedy. So friends, and especially students, uh, what I presented basically the basic understanding of Hahnemann of chronic diseases and how it got evolved by Dr. Praful Vijaykar in modern understanding of pathology, and how we can take a case and how we can proceed uh, more uh, quickly and in a more confirmatory way, so that we may become very much able to prescribe confidently and this approach has given me very good results in my practice. Now there are other approaches also, which if I will find time in future, I will discuss, are helpful in understanding homeopathy, understanding of patients, and giving more better prescriptions. But for this time, thank you all of you, and I end my presentation. Thank you for hearing me patiently. If you have any questions, you can ask.
Thank you very much, sir, for your wonderful interactive and learning session on this platform.
Okay.
And if there is any doubt or question from the attendees, they can ask, they can unmute themselves and they can ask their question. Sir is here with us now. You can also type your queries in chat box.
Somebody typed in chat box what actually miasm is.
Okay.
This is a long question. Yes.
Yeah, but I would like to give you in short what is miasm. According to Dr. Henneman, miasm was the etiology of diseases. Why we get diseases are broad classification of diseases. According to Henneman, why we get ill is due to some underlying factor which we inherit also from our in our genetics. Due to this underlying predisposition, we get diseases. So this is basic understanding of miasm. You can understand miasm as predisposition to diseases. Means we are programmed with certain uh, program which which get activated at some time due to some exciting cause, or automatic by itself. uh, this predisposition is termed as miasm. Basically, in understanding of predictive homeopathy, miasm is broader classification of pathology. Why we get ill, what type of pathology we have. uh, there are, what I explained, that there are three types of pathologies, like inflammatory, proliferative, and destructive pathology. So we understand miasm is broad category of pathology as a defense mechanism, that how we have to defend ourselves. We have to understand it, uh, in what category the pathology is. So if you are coming with a cancer, this is syphilitic pathology. Cancers, especially uncontrolled cancers, any type of gangrene, that is destructive. This is syphilitic miasm. If you are coming with a tumor which is not uncontrolled, basically the cancers which are limited to a place and that are not uncontrolled, that are in the psychotic pathology. And the inflammations, pain, and itching, and all these things in psoriatic pathology. So miasm is basically predisposition to diseases and a broader classification in order to understand how to treat homeopathically.
So there is one more question.
Okay.
What is difference between disposition and susceptibility?
Okay. Susceptibility or vulnerability is basically uh, what we the sensitivity of a certain for certain diseases. uh, Disposition is basically the symptoms which is through and through in our history, in our life. That symptomatology, that tendencies, that natural traits are disease traits which are we are supposed to have again and again. This is disposition. Susceptibility is our sensitivity, basic sensitivity, due to which we are got affected through certain exciting factor. That means susceptibility is basically when we get angry, when someone reprimand. If someone is reprimanding, we get anger. So this is our susceptibility, and this will become disposition when it becomes through and through again and again. If it is one time, that is not disposition. It is all susceptibility, acute susceptibility, that we have got some anger. But where if you get this thing again and again, then it becomes a disposition. Okay, I think it is clear. Anything else in the case, or in understanding of chronic diseases, if you want to understand anything?
So may I ask a question?
Yeah, definitely, Jhalak, you can ask.
Sir, if there is I mean, many people has a fear that if
Okay.
there is a disease running in their family,
Okay.
like diabetes or arthritis, and
Okay.
they and their siblings have gotten that particular disease, and after a certain age, they will also get that. They have a fear of it, so
Okay.
they started taking vitamins, minerals, and everything just
Okay.
to prevent that disease or to delay the onset of the disease.
Okay.
What miasm this situation covers and how it can be treated?
Okay. Now the most important thing is that we have to first to take the case individually. Means if my father is having diabetes, my grandfather is having diabetes, and also I am developing diabetes, so there is predisposition to diabetes. That is okay. But I how I am displaying symptomatology in diabetes is important, uh, which we have to take in history, and the miasm will be decided by the pathology I am having. Like if I am having only physiological problems relating with diabetes, and there is no structural changes involved, and there are no destructive pathology involved, then that diabetes will be soric diabetes. The diabetes can be psychotic diabetes also, and it can be syphilitic diabetes. Like if you develop peripheral neuropathy, if you develop neuropathy at the level of eye, you are going to be blind. You are having nephropathy, which is your kidney is being going to damage, then that will be syphilitic diabetes mellitus. Psoriatic diabetes, psychotic diabetes, and syphilitic diabetes. And I think for the most of the chronic diseases, these categorization can be done. Uh, so if we identify that it is a psoriatic diabetes, our approach is slightly different. If it is psychotic diabetes, if it is syphilitic diabetes, our approach becomes different. If you understand that it is a syphilitic diabetes, that means if your kidney is going to damage, or it is very much damaged, or your eye retina is very much damaged, then we have to try to understand the syphilitic disposition in that patient. Then what disposition, what syphilitic symptoms he is manifesting at the level of body and at the level of mind, and you have to enter the case with those symptoms, and you have to give most priority to those symptoms. But if it is psychotic diabetes, if it is psoriatic diabetes, you have to take case according to that. Okay, I think is it clear, Jhalak?
Yes, sir, it is clear. But what if there is no symptom at all? I mean, the blood sugar level is fine, every test is
Okay.
fine. This happens with people.
No, so there is okay. There is no need of as a treating patient if everything is fine. That is, there is slightly aggravation of sugar in his blood reports, and he has got no symptoms. That is okay, and he is coming to you for the treatment of diabetes. Then what is the approach Dr. Hanneman has said, and what is the basic approach? That you have to take a deep case now. These cases will be more difficult to treat, and you have to tell the patient that it is not easy that your blood sugar will come normal in just in few weeks or in few months. Just tell the patient that you have to continue your treatment for 2 to 3 years to cure your diabetes. Remember that especially in the cases of diabetes, it is a long standing problem, so it will take a long time, and with all the chronic diseases. So now you have to take the case fully. You have to probe the symptomatology at the level of mind, at the level of body, his childhood conditions, his relations to family, to social, and all. As deeper you can go, and try to fetch symptoms. You will get some symptoms throughout the history, and then you can repertorize the case according to the disposition, that giving highest priority to the higher miasm, and you get a remedy with 3 or 4 symptoms. You just give to the patient, okay, 1 dose, and after 1 month then again follow that case. There might be that that symptom has gone or not gone, and the patient might develop some new symptom or might not develop. So you again take a totality and give the remedy. It might be the same, it might be the different. So this way you can go on, go on, go on, and if you go on 2 or 3 years continue, definitely you will get certain symptoms which will be characteristic of that patient. You will understand that patient, and that will give a good result to the patient. And if what I understood your thing, that many patients come to your clinic or will come to your clinic and will say that my sugar has gone to fasting 140 and just cure me. This is not possible. Just tell the patient that it is not the thing that I am going to your anti-diabetic drug and your sugar level is just managing. I am not here to manage your sugar. I am just here to cure your sugar. At the fasting 140, you are not getting any symptom. That means your body is adjusted and adopted that sugar level and you have no problem. But if you want that the sugar level will not go up and you will not get into destructive diabetes, then you should continue homeopathy, and it will go on month and month and month, and then that will make you better in the long run. I think you got me, Jhalak?
Yes, sir. It's clearer now.
Okay, okay.
Thank you. Thank you, sir.
Okay, welcome. Anyone else? Anything? Anything regarding you? If you are a student and you just have any question, you will go in clinic and how you will start the things in a case, you can ask. If you have any questions in your mind and anything, if you want to know or discuss, or if you have any difficulty, any practitioner, if you have any difficulty how to tackle particular type of case, we can discuss. I'm here also to learn homeopathy, basically not to teach. I would like to learn also from all of you if you have anything to say.
Basically, questions makes you learn.
Yeah, definitely. Learning is together. Basically, learning is not individually. We learn from patients. If you are most of the students, you will learn from your patient. But the thing is that when you follow the proper guidelines, which is being depicted in Organon of Medicine in chronic diseases, then only you and just try to read and learn newer developments in homeopathy, then you can find the answers and the solutions of most of the problems. There are many things which I am not able to solve in my clinic. It's okay, but now after practicing after 15 years, I am many things are very clear. Which case I can improve, which I cannot. This is also clear, and I have learned many things from patients. So
definitely, sir. That's why we have invited you here to share your experiences.
Okay, thank you.
Sir, we are not having another question. Sir, how to know which symptom of medicine is red line and you need that symptom in your patient to get similimum? Sometimes it's evident, sometimes it is not.
Okay. So what I have learned that we must basically focus on the chief complaint first. When the patient comes, he comes with a problem. You first have to try to understand what is to be cured. As I have said that in a case of lipoma, the patient might have fear of disease as a main symptom, which he is not telling you. But then you have to ask the patient why he has come to you. What is the chief complaint and why it is problematic for him. What is getting a problem, actual problem for the patient is it might be a pain which is during swallowing, is having pain during swallowing and a peculiar type of pain, or any complaint which is not serious. If a patient is coming with non-serious complaint, then you have tried to understand his mind, why has he came in your clinic. That will be the chief complaint. The first try to understand what is the chief complaint. When you try to understand chief complaint, then focus on that chief complaint, that what are the modalities, how this chief complaint get aggravated, what is the effect of that chief complaint on his mind, what are other symptoms associated with it. Go deeper and deeper and deeper, and this will give you the basic rubrics or basic symptoms on which you have to prescribe. That will be the red line basically. And red line, what will be the symptoms which are peculiar, which are exaggerated symptoms, which are very characteristic symptoms. So you have to find out. Many times you will not find PQRS symptom. If you do not get there, no issue, you just prescribe on the common symptoms also, no problem. But you must have a thing that the remedy must cover certain symptoms definitely at that. And it is better always in a chronic disease that at the level of physical level and at the level of mind, both level symptoms are to be covered in a remedy that will guide a more better remedy. Okay.
So there's one more question.
Okay.
So we got a case of organic changes as well as physiological changes of two different organs at the same time.
Okay.
How should we approach the case?
Okay, definitely this approach is basically ki what is more syphilitic in particular organ. The organ which is more showing more syphilitic symptomatology are to be treated first, are to be given priority, and the organ which is showing by the way my psychotic pathology or soric pathology are to be given secondary importance during treating a case. Means after treatment the syphilitic pathology should go down, and then psychotic pathology, and then soric pathology. So you have to understand ki what is more syphilitic pathology in a case at different organ levels. If a patient is having a destructive pathology and at a level there is inflammatory pathology, you have to focus on the level of syphilitic pathology. Okay.
So thank you so much, sir, for delivering your lecture today.
Okay.
And I think you gave a very fine understanding of miasm to everyone here.
Okay.
And understanding of Medorinum, Puja, what is the basic differences and what is the basic approach we should carry for this particular medicine.
Okay.
And I think it was a very fruitful session for all of us.
Okay.
We learned a lot.
Thank you.
And thank you so much for being here on this platform.
Okay.
Thank you, sir.
Okay,
Thank you,
so
sir.
we can wind up, and thank you all patiently hearing me. And if you have got any question or anything, you can WhatsApp to me also. I will try to give answers also. Any student can give me that question if anything comes in his mind. I will be available, and we will meet again if things will go on. Okay, so
Definitely,
thank you
sir.
all of you.
Definitely.
Okay,
Thank
so
you so much.
Good night, sir.
okay, good night. So I stop sharing screen, I think.
Sir,
Yes.
I already have managed this thing. So
Oh.
I will just have to end the session now.
Okay.
So thank you everyone. We will meet on Friday now on 2nd of July. Till then, bye bye. Take care. Good night.
Bye bye. Good
Good night.
night. Good night,
Thank
everyone.
you.
Okay.